Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 65 of the Ask Dr. Angela podcast. I hope that this podcast finds everyone alive and kicking. It is cold in Jersey, but quite frankly, it's about time. I mean, I just thought it was really weird that the humidity was like 85% on Christmas and folks were wearing shorts. I mean, that's just not winter. But now winter is upon us. It's been like in the teens to 20s, and we're supposed to get like a foot of snow this weekend. We are so looking forward to this because remember, I'm a Midwesterner. I'm used to cold and snow. So we've got our snow boots out. I've got my ski gear, my little one's got her gear, and we're ready to build some snowmen. Notice the plurality in that. Igloos and snow angels. So let's jump right into today's podcast issue, delayed cord clamping. Recently, I've been getting a lot of requests from my patients. Dr. Angela, can you please, delay on clamping the cord? And frankly, I don't have a problem with it. As long as things with the delivery are going smoothly and there is no imminent jeopardy to mom or baby, I have absolutely no problem delaying clamping of the umbilical cord. In most case scenarios, folks will clamp it and cut it 30 to 60 seconds post-delivery. But if you are going to officially delay cord clamping, the recommendation is to wait anywhere from 1 to 3 minutes after birth before you cut and clamp, or should I say clamp and cut the cord. Now, some recent data shows that there is some benefit to delayed cord clamping. Increased blood transfer from the placenta to the baby. That leads to an increase in baby's blood volume, which leads to an increase in baby's iron stores, which lead to healthier brain development. Delayed cord clamping has also been associated with, just helping baby to make a smoother transition from life on the inside to life on the outside. Certainly increased blood supplies to the lungs increases baby's ability to properly oxygenate. A lot of the studies that we're referring to really show the most significance in preterm babies who certainly seem to show an increased benefit from delayed cord clamping. Another major finding, an increase in social skills and fine motor skills in those infants whose cords were delayed in being cut. Of interest, those children who did undergo delayed cord cutting and showed an increase in social skills and fine motor skills were predominantly male, i.e. MALE. So you know me, I'm always keeping my eyes and ears wide open so that I make sure that I'm giving you the latest and the greatest in obstetric and gynecological care. But again, with regards to patient requests for delayed cord cutting and clamping, I have absolutely no problem doing it. I've seen the recent data stating the benefits. And again, as long as there is no imminent danger to mom or baby, I absolutely have no problem doing it. And ACOG really doesn't endorse this one way or the other. Big surprise there. So having said that, I hope that today's podcast has benefited you somewhat. Hopefully you got something out of it. For those of you that have a topic or question that you would like presented on the Ask Dr. Angela podcast, please go to www.askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we use your question or your topic, someone from my team will reach out to you and send you one of our bomb-ass t-shirts, and they are going out all over the place. I just shipped one off to India. Postage is killing me, but you guys are so, so, so worth it. I appreciate the love. I appreciate the continued support. So let me leave you with this. Burn the candles, use the nice sheets, wear the fancy lingerie. Don't save it for a special occasion. Today is special. Every day is special, people. Take advantage of it. Live life to the fullest in the moment. Thank you so much for tuning into the Ask Dr. Angela podcast. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 66.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.